Hi, my name is Daila.
And I am Hope Daniels. Today we are going to talk about three different systems: the digestive system, the respiratory system, and the urinary system. Let's start with the digestive system. First, what is the purpose of the digestive system?
The digestive system allows us to utilize food from such diverse sources as meat from an animal and a root of a plant and utilize them as energy source, whether it is the ability to coordinate the chewing of the food without injuring our tongue and our lips, or the propulsion of the food from the stomach into the duodenum while releasing the appropriate enzymes. The digestive system allows us to manage the process without much thought and often while performing other tasks. Now, what organ makes up the digestive system and what are their functions?
Mouth. The mouth is the beginning of the digestive tract, and in fact, digestion starts here. When taking the first bite of food, chewing breaks the food into pieces that are more easily digested, while saliva mixes with food to begin the process of breaking it down into a form your body can absorb and use. Esophagus. The esophagus is a long, thin, and muscular tube that connects the throat to the stomach. It forms an important piece of the gastrointestinal tract and functions as the conduit for food and liquids that have been swallowed into the throat to reach the stomach.
The stomach. Your stomach is like a sac-like organ with strong muscular walls. In addition to holding food, it serves as the mixer and the grinder of food. Your stomach makes acid and powerful enzymes that breaks the food down and changes it into a liquid or paste. The small intestine is a part of the intestines where 90% of the digestion and the absorption of food occurs. The other 10% takes place in the stomach and the large intestine. The main function of the small intestine is to absorb the nutrients and minerals from food.
Liver. The liver has multiple functions, but its main function within the digestive system is to process the nutrients absorbed from the small intestine. Bile from the liver secreted into the small intestine also plays an important role in digesting fat. In addition, the liver is the body's chemical factory. Pancreas. It is part of the digestive system and produces insulin and other important enzymes and hormones that help break down foods. Large intestine. The major function of the large intestine is to absorb water from the remaining indigestible food matter and transmit the useless waste material from the body. What is the path food travels throughout the digestive system?
Chewing mechanically mixes food with saliva from the salivary glands, analyzes in the saliva chemically digested starch in the food. The mixing process is lubricated by munching and a slippery protein in saliva. Each mouthful takes approximately 30 to 60 seconds. The next part is swallowing. The food is formed into a small bag called a bolus, which is pushed to the back of the mouth by the tongue. Involuntary muscles contractions in the pharynx then pushes the bolus down towards the esophagus. This swallowing reflex takes about 1 to 3 seconds.
Peristalsis. Ingestion 3. In the esophagus, the bolus is moved along the rhythmic contractions of the muscles present in its walls. For a medium-sized bolus, it takes about 5 to 8 seconds to reach the stomach. Time to empty stomach. Food is mixed with gastric juice. Strong muscular contractions in the stomach will reduce the food to chyme, a thick, milky material. The pleuric sphincter at the lower end of the stomach slowly releases chyme into the, the duodenum. Emptying the stomach takes 2 to 6 hours.
The small intestine. It takes 3 to 5 hours from entry to the duodenum to exit from the ileum. The small intestine structure of folds, villi, and microvilli increase the absorption surface area and allows maximum exposure to enzymes and complete absorption of the end products of digestion. Now, how does the digestive system connect with other systems?
Constipation, a condition in which there is difficulty in emptying the bowels, usually associated with hardened feces. The lower the food moves through the digestive tract, the more water the colon will absorb from it. Consequently, the feces becomes dry and hard. Drink more water and or eat more fiber, especially soluble, not fermentable fiber. The article summary for the digestive system basically explains what the digestive system is, what it does, and the process of the digestive system.
The digestive system works very closely with the circulatory system to get absorbed nutrients distributed throughout the body, while the digestive system collects and removes undigested solids, and the urinary system filters compounds from the bloodstream and collects them in urine. Now, what is a medical condition, problem, or disease that can be associated with the digestive system? Now, on to the respiratory system. The main function of the respiratory system is the exchange of oxygen from the atmosphere for carbon dioxide produced by the cells in the body. Other functions of the respiratory system include participation in the acid-base balance of the body, phonation, pulmonary defense, and metabolism. Now, what organs make up the respiratory system and what are their functions?
Trachea. The trachea is a wide, hollow tube that connects the larynx or voice box to the bronchi of the lungs. It is an integral part of the body's airway and has the vital function of providing airflow to and from the lungs to respiration. Lungs. The lungs' main role is to bring in air from the atmosphere and pass oxygen into the bloodstream. From there, it circulates to the rest of the body. Help is required from structures outside of the lungs in order to breathe properly.
The diaphragm separates the thoracic cavity containing the heart and the lungs from the abdominal cavity and performs an important function in the respiratory. As the diaphragm contracts, the volume of the thoracic cavity increases, creating a negative pressure, which draws air into the lungs.
The larynx is a tough, flexible segment of the respiratory tract connecting the pharynx to the trachea in the neck. It plays a vital role in the respiratory tract by allowing air to pass through it while keeping food and drink from blocking the airway. Vocal cords. The vocal cords are folds of tissue located in the larynx/vote box that have 3 important functions: to protect the airway from choking on material in the throat, to regulate the flow of air into the lungs, the production of sounds used for speech. How does the respiratory system connect with the other systems?
The epiglottis is a leaf-shaped flap of the cartilage located behind the tongue at the top of the larynx or vocal box. The main function of it is to seal off the windpipe during eating so that the food is not accidentally inhaled. Okay, the circulatory and the respiratory systems work together to circulate blood and oxygen throughout the body. Air moves in and out of the lungs through the trachea, bronchi, and bronchioles. Blood moves in and out of the lungs throughout the pulmonary arteries and veins that connect to the heart. Now, what is a medical condition, problem, or disease that can be associated with the respiratory system?
Bronchitis, a condition in which the lungs' airways become damaged, making it hard to clear mucus. Bronchitis often is treated with medicines, hydration, and chest physical therapy. Your doctor may recommend surgery if the bronchitis is isolated to a section of lung or you have a lot of bleeding. The following steps can help prevent bronchitis. Make sure you and your children have had the vaccines for measles and whooping cough. Get annual flu vaccinations and advised pneumonia vaccinations. Stay away from harmful substances that can damage your lungs, such as smoke, gases, and fumes.
Finally, onto the urinary system. The urinary system, also known as the renal system or urinary tract, consists of the kidneys, ureters, bladders, and the urethra. The purpose of the urinary system is to eliminate waste from the body, regulate blood volume and blood pressure, control levels of electrolytes and metabolites, and regulate blood pH. Now, what organs make up the urinary system and what are their functions?
The organs of the urinary system include the kidneys, renal pelvis, rectors, bladder, and recta. The kidneys remove waste, control the body's fluid balance, and keep the right levels of electrolytes. The renal pelvis functions as a funnel for urine flowing to the rector.
The ureter is a tube that carries urine from the kidneys to the urinary bladder. The bladder stores urine, allowing urination to be infrequent and controlled. The urethra is a tube that carries urine from the bladder to the outside of the body. Now, how does the urinary system connect with other systems?
The urinary system works with the lungs, skin, and intestines to maintain the balance of chemicals and water in the body. Other factors in urinary system function include fluid loss through perspiration and breathing. What is a medical condition, problem, or disease that can be associated with the urinary system? The article summary basically is explaining what the urinary system is, the organs involved within it, and what role each organ plays in the body.
Kidney stones is a medical condition associated with the urinary system. It is inflammation in the kidney due to a bacterial infection. Treatment includes antibiotics and often requires hospitalization. Prevention includes drinking fluids, especially water. Fluids can help remove bacteria from your body when you urinate. Urinate as soon as you need to. Avoid delaying urination when you feel the urge to urinate. And often you avoid using female products in the genital area.